was important information, and as Erin said, this being the first of several series of webinars. So System of Care 101. System of Care, a lot of people may refer to System of Care generically and say we're going to get together and create a system of care. But System of Care is really a term of art in the children's mental health world, and it means something specifically. And it really refers to a framework of the way we provide services in children's mental health, and across disciplines, rather. It's even pertinent to education, child welfare, juvenile justice, and mental health service providers. So it's a cross-discipline framework. And before I really get into defining the particulars of what System of Care is, I'd really like to look at, what would an ideal world look like for if we were serving youth and families, what would we need to consider? One of the basic tenets and primary values of System of Care is partnering with families. And as Erin said, the next webinar is really going to dig down and drill deeper into tools and concepts about that, not about us, without us, and looking at family and youth involvement. But as we deliver services, as we build a system of care, that we're in true partnership with families and youth who are old enough to speak for themselves. What does that look like? From an individual service planning level to developing a community or statewide infrastructure to do a better job at delivering services. So I'd like to turn it over to hear from our lead family coordinator, and she's the family coordinator at Via Hope, Angie Jackson, and Via Hope's a statewide training and technical assistance center. So I'd like to hear from her first so she can talk about the need to do this work. Angie?
Good morning, everyone. I'm Angie with Via Hope, but I'm also a family member. From a family's perspective, as parents, we feel, or sometimes we assume, we can just use our knowledge and our personal and professional experiences to help our children as they go through some difficulties. And many times we can. However, when it comes right down to it, our children's health and well-being are so close to our hearts and hit so close to home that we need the help of the different systems to assist us in making it all work for our children. We desire those positive outcomes, and we desire to travel roads to reach those outcomes that don't blame us or don't accuse us of being bad parents. We just want to travel those roads and ensure that our children do achieve the best outcome for their situation. And we often experience others' perceptions of us and our families and our children, and many times those perceptions are not right. I personally remember being called to my son's school on many occasions, but this one particular occasion I remember being called to my son's school, and the school that I worked at was for small children and infants, so I wore very casual clothing and a smock. And when I got called to my son's school, I didn't have time to go home and change clothes, so I just went to his school as I was. And the assistant principal greeted me, and the first thing he said was, "Oh, we need your mother." And I'm like, "You call for the mother of Jamie?" And "Yes, we need your mother." And I'm like, "I am Jamie's mother." I guess he perceived that I may have been too young to be Jamie's mother, which was a little bit flattering. However, he perceived that I was probably a teen mom, and in all actuality, I was not. And then he looked me up and down, looked at my attire very judgmentally, and he said, "Well, we need to send someone into the home to help you and to teach you and educate you, train you, so that we don't see these behaviors from your son at school." And at that point, I couldn't even respond. I just took my son, took him home. As I was leaving out of the school, I heard the secretary say to him, "Do you know that she's like the lead teacher at Head Start?" she's a, you know, and she informed him she's degreed, she's, you know, she's the lead teacher over there. They answered to her, and he was very shocked. But had he just taken the moment to talk to me about my child, I could have given him some tips, and not even because of my education, but I could have given him tips on how I de-escalate my son and what works best for him to de-escalate him. But he never even bothered to ask that. So parents, you know, we don't deserve for people to jump to conclusions about who we are, or if we're educated, if we're not educated, whatever is going on. Don't jump to conclusions, but give us the respect of asking us what works for your child. Do you know what works? What can help us help your child? And then we get into being pulled in this way and that way, being pulled so many different directions. And a lot of entities are really trying to help us, but sometimes that help turns to hinder. I can recall working with a family whose child was involved in multiple systems. The family was experiencing with their youth having to go through the juvenile justice system, having to go through child protective services, and they were involved with their local mental health authority. All three of those systems put plans in place. The local mental health authority was doing a wraparound plan with that child, and it was a great plan on its own, but juvenile justice was doing a plan that was separate from the wraparound plan, and child protective services had entered the family into child preservation, and they had a plan. Well, when we sat down, the mother was so frustrated because she was like, well, through the wraparound plan, we want him to take an art class, and it's on a Saturday morning. But family preservation is, you know, allowing us to get the much needed counseling that we need. And that's on a Saturday morning. And juvenile justice said, no, the child needs to be doing community service on a Saturday morning. Well, alone, each one of those plans were awesome. However, they would have worked much, much better for the family had all the services been sitting together at the table and coming to a common ground for that youth and for that family. So this is how systems of care can come in and really work for a family, and systems not just working independently on their own and seeming like they're not that the plans are not working, because each one of those plans were very good plans. They just needed to be sitting at the same table working together. So from a family's perspective, you know, we want you to know that we're ready to sit at the table. We want to sit at the table. We do have good input to make sure that our plan, that a plan that's put in place is viable for the entire family. And as a family member, I say thank you for listening to us and having us drive the car and not just be in the car. Sherry?
Thank you, Angie. That really appreciate that voice and the courage that it takes for families to come together and to even ask for assistance. You know, whether it's anybody who initially meets a family member, whether it's the school or child welfare or a mental health service provider, it's, you know, really taking a look at, you know, are we respectful? Are we entering into respectful relationships with family and meeting them where they are at? So with that, I'm going to go ahead and launch into, and I'm going to come back to this slide and talk about asset in a moment. I'm going to go ahead and launch into the definition of system of care, and you have a handout available to you that's entitled System of Care Concept and Philosophy. It's a one-page, it's very nicely laid out, and it's also in the context of another handout. But if you pull that one page, you can see the definition at the top. And on this slide, it says the system of care is a spectrum of effective community-based services and supports for children and youth, or at risk, for children and youth with or at risk of mental health or other challenges and their families. So we're looking at family systems, not just units of services for children and youth. And these services are organized into a coordinated network, builds meaningful partnerships with families and youth, and addresses their cultural and linguistic needs in order to help them function better at home, in school, in the community, and throughout life. So that's the overall definition of system of care and the framework that we're shooting for to achieve. And again, and I think Angie said it very nicely as far as looking at that cross-systems approach, so a family's not struggling with an IEP, an IHP, an ITP, all these different individual plans where their education, transition, habilitate, that we're coordinating our efforts. So we've been doing system of care work in Texas for going on 15 years now. And so we've got a lot of experience with system of care, and we're looking at building on that and maximizing that. Next, I want to draw your attention to the 3 core values, and they're also listed nicely on the handout. We've mentioned family-driven and youth-guided, as Angie put it. They're not sitting in the back seat. We're not saying, what can we do for you, but what can we do with you as a family, as a provider of services? What is it that you need? Instead of just offering, here's our menu of services, pick one, but really individualizing services. And then youth guided. As soon as the youth is old enough to speak for themselves, they can be a partner in the plan. And that is very different than just the family involvement, that you have the youth involvement, especially as youth are transitioning to adulthood, and they need to be front and center and part of that plan. So that's an example of the first core value. And then community-based is another core value. And that is, our goal is to provide services within the home community. And that's not to say that there may be times that a child or youth needs to be placed, or there needs to be stabilization or whatever. But if there is placement involved, those need to be purposeful, and we need to look at what measurable outcomes are we looking for that child to come out of that placement, what needs to be going on with the family to receive that child or back into a safe and nurturing family and within the community. So it's providing, looking at the goal being permanence within the community-based services. And then the next value is cultural and linguistic competency. And then again, that we all have cultures. The organizations that we work in have particular cultures. Our families have cultures. So the idea is that I'm going to respect the culture of the family that we're serving. I'm not going to pass judgments based on my frame of reference for my culture. And if this family has a first language preference, that will be utilizing services to make sure that there is clear communication and that we are respectful of that culture. And we're going to have some of a system of care community speak more to that in a moment. So those are the 3 core values. And then to follow that, and I'm not going to go over each and every one, but there's 13 guiding principles that are associated with the system of care framework. And as you can see, I've dropped in some just point words, flexible array of services, so that we are flexible. Families are dynamic. And if we're providing unconditional care and being flexible with our services, we're supporting that family and the flexibility of the services and individualizing and customizing to that family. We're looking at practices within a system of care framework that are evidence-informed or evidence-based. We're looking at most normative environments for the family and youth. And again, as we've said before, family and caregivers are full partners in the process. The other one I just want to mention on this is that we're really looking at coordinating services that are developmentally appropriate. So if we're looking at young children, that those services are set up that way. And if we're looking at young adults, then then we're adapting and making sure that those services are targeted based on their age and their developmental age. Also, data, looking at accountability, making sure we have those measures that we're accounting for services. If something's not working and the data is showing us that it's not working, we're making those adjustments, and we have that built into our system. So those are some of the principles. So there you have it, the definition, 3 core values, and 13 guiding principles. And that's a nice little package deal, but I can assure you it's very complex to put those principles into practice and have the checks and balances that you need to do that and to pull it off. So a little backdrop on how we've done system of care in Texas is the Substance Abuse Mental Health Services Administration, which we fondly refer to as SAMSA. But that's a federal branch of Health and Human Services. They have funded over the years, and you see here a map of the United States, and over the years there's been 5 to 6 year multi-million-dollar cooperative agreements with communities to help drive and develop system of care within those communities. And you can see there by looking at Texas that we've had 6. We're going to hear from 2 communities today about system of care and their system of care work, especially related to the core values. And we're going to hear from 1 community that's just embarking upon their system of care work as well. So just to kind of highlight those communities in Texas, the Children's Partnership was the original federally funded system of care site that began in 1998. And their federal funding ran through 2005, but all these communities that I'm stepping through are sustaining their work of system of care. So these are community practices that we can really learn from and that we are purposefully and thoughtfully learning from right now to develop a statewide strategic plan to expand system of care. Then we had the City of Fort Worth Community Solutions, and then El Paso Border Children's Mental Health Initiative, who's now named the Mental Health Support Services in El Paso, so they're located at the county office. And then Harris County System of Hope is another federally funded, or has been a federally funded, system of care community. And 2 communities in Texas right now are still funded, and that is hand in hand, the Tarrant County area along with surrounding counties. They are looking at an early childhood approach, under 6, to system of care work. And then the Rural Children's Initiative around the Plainview area, about 11 counties up there that are looking at rural approaches. So we, between our current funded and looking at urban, border, city, big urban through Houston, we have rich experience in the state of doing system of care work. And an initiative that has embraced the principles and practices for system of care has been the Texas Integrated Funding Initiative. So there has been small state-supported grant funds that have informed some of those communities before they became federally funded sites. So that work has been to system of care work. Other initiatives, interagency initiatives that have really looked at a mental health component have been the community resource coordination groups, the local CRCGs and the work that they do, the Safe Schools and Healthy Students grants that are available really hone in on looking at how can we do business differently with children's mental health. Okay, before I get to that next one, I'm going to back it up here and talk to you where we're at with ASSET, which is Achieving Successful Systems Enriching Texas. And from those 6 communities, we have now a statewide, Texas was one of 24 successful grant recipients of a 1-year planning grant to look at how you can do a statewide expansion approach for system of care. So we're using all the experience from those 6 communities and from the work we've done with TIFI, with the Texas Integrated Funding System, and seeing how we can roll this out across the state through ASSET. So we'll hear from 2 federally funded system care, or past federally funded system of care communities, and 1 ASSET community that we're gathering information on. So with that, I want to touch real quickly on a distinction, because sometimes this gets confused. system of care and the difference. How many of you have heard of, let me throw this out, how many of you have heard of wraparound? If you can hit the poll button there and tell me if you've heard of wraparound. Now we have a lot of people who've heard of wraparound, like 80, 89, 80, okay. Okay, so most of you are very knowledgeable with the wraparound practice, so I'm not going to go heavily into that, but just to say system of care is a broader community, or in our case too, a statewide approach at developing a plan of care for a community. So that takes into account a governance structure, looking at service delivery, looking at how we finance that, just multiple pieces, and that's a community plan of care. Wraparound has to do with an individual service planning or an individual plan of care. And so that is guided by the family or driven by the family and guided by the youth if they're old enough. So even to make the distinction, and wraparound is an evidence-informed practice. So that's an individual service planning tool, whereas system of care is a broader framework from which wraparound can be covered. That I want to make one more distinction with the community resource coordination groups. Those are county-level interagency service planning teams, and they can launch a child and family wraparound plan, but they're not a wraparound team. So that's just distinctions there. And in your handout, there's a handout called Wraparound Process, and I'm going to point you to a website here toward the end that will give you more information about wraparound as well. So that's the difference of a system of care and wraparound approach. And oh, as a matter of fact, I added it to this slide. So the National Wraparound Initiative is a wealth of information about wraparound. So you can look that up and learn more about it in addition to the handout. So for more information about wraparound on the national front, there's the Technical Assistance Partnership. And here is a link to it on this slide, as well as the Georgetown National Technical Assistance Center for Children's Mental Health. So those are two resources. And then from within our state, here are some resources as we're building our website for the Texas System of Care. We have a Facebook page, we have a Twitter account, and a Pinterest. And I'm learning all this too. I think some of this is very generational, but it's a great social media way to get the word out. So with that, I think that there's a lot of good assets that have been going on in our state. The stars are aligned for us to continue to do this work and push this work out to other communities that are interested in doing this work. So with that, I'll turn it back to Erin. Thank you.
Sherry, thank you very much for your presentation. We did have one question during it. I just wanted to ask you real quick, and then I'll mute my mic, and that is, do you know of a single point of contact for law enforcement as to how they can access system of care? It actually came in through our Twitter feed, so this was a tweeted question. So I'm going to mute my mic and let you answer that.
And can you repeat that again, please, Erin? Is there a single point of contact for law enforcement to access system of care? Was that the question?
Yes, that was the question.
Okay. I think there's different levels of sophistication at different communities of how they've implemented system of care, so it really depends on the community. So a good point of contact that we are growing is the local mental health authority too. That would be a place that consistently around the state that I think folks could call to say, are you doing system of care work? And who would be the contact? Is there a governance structure in place? And you could find out more information probably through accessing the local mental health authority. And then in some communities, the schools will be strong partners. In other schools, the county health and human services will be strong partners. So, but as a consistent point of contact, I think that the local mental health authority might work there. I hope that helps.
Thank you again, Sherry. This is going to move on. Now we're going to move on to our next presenter. Her name is Miss Laura Pivoto. The way we structured this webinar is we wanted to be able to provide a broad overview of the concepts and principles of system of care, and I think Sherry and Angie did an excellent job of providing that overview. But in addition to that, we wanted to be able to actually show how it works, or what are some key things that are going on in some communities. So we've structured the next portions of the webinar on the system care values of community-based and culturally and linguistically competent. And we've asked Laura to represent Travis County Children's Partnership in that effort. So I'm going to read you Laura's bio. Laura is the Prevention and Intervention Manager with Travis County Health and Human Services and Veterans Services. In that capacity, Laura provides project oversight, support, budget management, and clinical oversight and case planning. Laura has a bachelor's in science and social work, and she's selling herself short, but I've heard that she's an excellent presenter and a really dynamic lady, and has like 19 hats that she wears. So Laura, bear with me while I turn my mic off and pull your PowerPoint up, and it's all yours.
Thank you, Erin, for that nice introduction. I appreciate that. Hopefully I will be an entertaining presenter. It's my first time to do a webinar, and so not having that audience feedback might be a little challenging, but I'll try to persevere. So I'm really happy to be here today. I'm happy to share the knowledge that we've developed out of Travis County, our experience. We've been doing it for a while, so we've made lots of mistakes that we've been able to learn from, and we're hoping to share some of that information so that you don't have to make the same mistakes that we've made. I'm going to go ahead and move through to the next slide. I thought it would be really helpful before we got into the details of the presentation to just explain our journey in Travis County. We've been doing this for about 20 years, really trying to evolve into a system of care community. It started in 1989 when we started our community resource coordination group, and from there we became a SAMSA site in 1998. Then we transformed our CRCG. From there we had sustained the Children's Partnership, and then we began integrating other programs and opportunities and services in our community into the system of care continuum. Then we had the opportunity to work with the YES waiver in Travis County, and now we're collaborating with the asset grant. So we've learned and grown and developed through that journey, and the journey is not done. But we do have some lessons learned that we think we can share, and we hope that you can individualize those to your local communities. So in addition, just so that you're oriented to what we do in Travis County, this real quick brief slide talks about our system of care initiatives. And we look at our community as a continuum of care where we have very intensive high-level services for youth and families and children who have very complex needs to those that have less levels of intervention based on need. And so we have several system of care interventions. We consider our CRC one of our interventions. And of course we have the Children's Partnership, which we consider our flagship as it's the longest sustaining system of care. Then we also have the CPS Reintegration Project, Triad, the Youth and Family Assessment Center. And that having 28 care coordination staff in our community with 9 entities supporting those staff. And then we also have 3 parent liaison staff. And I'll talk about that more later in the presentation. But that's who we are in Travis County. Okay, moving on. All right, so my role was to talk about 2 of the values in a little bit more depth. And I know Sherry hit on these roles in general, but I want to go into them in a little bit more detail. The first one is family-driven and youth-guided. And in that slide, I've highlighted some words: family, determining, primary, decision-making role, and equal partners. I think what I wanted to say about this slide is that you really need to read it, and you need to understand it, and it needs to inform and change your practice. Because what we're talking about here is revolutionary. It is walking away from maybe how you were trained initially, the idea that you were the professional who had all the right answers and all the right tools, and that you then dictated that service package to the family, and if they only engaged correctly, then they would benefit and change. And if there was no benefit or change, they must have not engaged correctly. This is about stepping way back from that and saying the only people that truly know what's right is the family and the child and the youth, and that they have the expertise and the strengths and the challenges all well defined in their home, and they simply need you to listen, to understand what they're saying, and then to give them the tools that they desire in the way they desire it, to be able to succeed towards their personal goals. And that requires you as a professional and as a community to change the way you do business. So these values are important for you to understand and then to take and see how do you apply that to your local community, how do you apply it to your practice. The one about engaging youth as equal partners is a really interesting concept that we're still developing in Travis County, in the sense that having a youth at the table isn't necessarily an equal partner. It's really giving them a voice and allowing them to take risk and changes which you may not be so comfortable with, or hearing what they have to say. And so I encourage you again to really understand the values and figure out how they're going to play out in your local community. What are you going to be most comfortable with, and what will you be most challenged with as you try to implement this value? All right, so what we found is if we're going to hold true to these values, which we believe are paramount to being successful, and it's who we want to be as a community, that we had to put some infrastructure in place. Pieces that reminded us of the business, pieces that helped us stay true to the model, and allowed us to do the work in the way that we wanted to do that work, in partnership with families and with youth. So the first piece is fidelity to wraparound process. If you don't have fidelity to the model, then you're not able to actually implement the model, and you're not going to have the success, and it's not going to have the value. And if you don't have success and value, people aren't going to want to sustain it. So you've got to stay true to the model. So for us in Travis County, we created and sustained a training team of individuals that have parents, professionals who've been trained in wraparound, who've been trained in the system of care, and they provide training to our local community and others throughout the state to reinforce the system of care values, to allow us to practice the wraparound process, to hear from families directly so that we can be ensured that we're learning how to partner effectively with families. And that change is harder for us as professionals than it usually is for the family. So we really have that work in the training team. Then we also have a position called our Quality Assurance Manager. And in that position, we have a person who reviews how we're doing our work and are we staying true to the model, provides technical assistance and guidance. Then we have system of care supervisors that are out in the field who are working with our coordinators, reinforcing those values, helping with difficult situations, helping support teams as they navigate the systems, being there clinically as well as reinforcing the system of care values in the wraparound process. We have care coordinators. We have to have people that are trained in the system of care and trained in the wraparound process to deliver the work in partnership with families and youth. So they're trained and they're supported and they utilize the wraparound process. And then for Travis County, one of the things that we were able to sustain that we feel very proud about and value immensely in our work is our parent liaisons. We have parents who are our partners, who are sustained, funded positions, who are paid at an appropriate level for the work that they do. They have full benefits, they're staff, and they've been on staff for many years. And they are parents of children who have mental health challenges, who've navigated our systems. And they work in partnership with the care coordinators serving the families. They on occasion work independently in serving families. They provide education to our community, they provide advocacy, and they keep us real and grounded in the work that we do and remind us of what we're about and what we're supposed to be doing every day. So having those individuals around, seeing them in the hallway, working with them day to day, remind me and humble me about my work and what I'm supposed to be doing. So we find that piece extremely valuable. Next, more infrastructure that helps support the idea of being family-driven and youth-guided. We have a 501(c) nonprofit board, the Children's Partnership Board. And that board, we encourage family representation, community members, and agency representation. And that board helps guide us in policies and procedures, but also they're advocating in the local community, making sure that the system of care values is being spoken in other areas, being reinforced, being funded, being understood. So the board has a role of not only supporting day-to-day operations to some extent, but also the wider community and making sure that as a community as a whole, we're supporting our transformation to a system of care. We also have community collaborations. These community collaborations are about supporting specialized populations within our communities, children with mental health challenges, other groups. And what we're finding is because system of care is so powerful, because it works so well, because it really makes a difference in the lives of children and families, and also the professionals, that people are wanting to ensure that they have family voice at the table. And so we have ad hoc community meetings where we're talking about how can we have a family representative here in this agency, and how can we have family voice here, and what does that look like? So what you'll find is once your community has started to embrace those system of care values, they'll want that, and they'll want it in all areas. And so we're seeing that expand to the community collaborations, and we're providing support in those areas, and we're also rejoicing every time we see a family member at the table whose voice is being heard. And then we also have what we call family support and education through family celebrations. We think it's important for families to get together and celebrate their successes, to celebrate just being themselves, to be around other families who have had similar struggles and similar challenges, but also success. And so we have family celebrations 4 times a year where families get together, they eat, they talk, they celebrate, they play games, and they're able to be reinforced that the struggles that they have are similar to other people's. It's a normalizing experience, and the staff are working alongside, eating beside, and interacting with the families so that we can feel as one community. And those can be very important experiences when we go into our team meetings or go before Commissioner's Court. We're also people that know each other and respect each other. Next value that I get to talk about is community-based. Now this one I think is a very critical piece to being able to implement a system of care successfully. And the definition is fairly wordy, but bottom line for us, and what I think of in Travis County, is a diverse group of community members working together to ensure that the system of care values can be supported in our community and the wraparound process. And so again, we put infrastructure in place to support that. Systems management and infrastructure that we have in Travis County that we believe allow us to facilitate the system of care values and the wraparound process. And you're going to see some of this repeats from what we talked about in the family driven. And the point to that is that all the values are very interwoven. You really can't have one without the other. You need all the pieces to do this effectively. So again, how do we ensure that we have infrastructure that supports community-based, the training teams, so that our people can be trained locally? We have the system of care managers and the system of care management team. That system of care manager takes on the piece of not just day-to-day operations, but the advocacy and education to the community, going out to various entities and explaining system of care, explaining how it could work in their agency, how they could partner with us effectively. Then we have a system of care management team that is across disciplines and across agencies that works together to help make decisions about how to support families, how to integrate practices, how to improve how we're doing, making sure that the family voice is heard and is paramount in our decision making. And of course, on that team is family representation. Without that, we couldn't be doing the work. The quality assurance position again. And then the other piece that's somewhat maybe unique to Travis County is that our Community Partners for Children, which is the transformation of our local CRCG, is our single point of entry for children with complex mental health needs. So if a child is looking for a wraparound support or the family is looking for wraparound process as a way to manage the child's mental health, they're coming through our CRCG, Community Partners for Children. They're meeting with the community for the first time. They're getting an individualized plan developed for them at that moment in collaboration with them based on the choices they make at the meeting, and they're being made eligible for services right then and there, so that the next step is simply for them to be enrolled into the Children's Partnership or other initiatives that they desire. So that allows all of us to be together with the family from the very beginning and prevents us families having to hop from meeting to meeting to find the best fit. And then the other piece that we have that we think is really important is you've got to have data to be able to support what you're doing, the number of families you're serving, the type, what the families look like and what the children look like and what their challenges are. And you need to be able to put that in a data form. And then you need to be able to talk about your successes and your challenges within that data. So we have a shared data system called the Clinical Manager, and everybody that's in a System of Care initiative is putting data into that Clinical Manager so that we can report up and report out. This next piece is the infrastructure that I have it under community based, but again, it's about family driven. And it's the piece that allows us to have individualized services and supports for our families so that they can have choice. Because if you don't have choice in your service provision, then you're not reflecting the values of system of care. So what we have in Travis County is a provider network, and that provider network is managed by our local MHA, our Mental Health Authority, Austin Travis County Integral Care. And they are considered our MSO for that provider network. They're considered our managed service organization. And their role and responsibility is to recruit, credential, contract, facilitate payment, audit, and review service provision for all of the providers on the network. And that network ranges from anywhere from 100 to 125 active providers at any one time. These providers are made up of both traditional and non-traditional service providers. So traditional thinking individual and family therapy, non-traditional think aquatic therapy or respite. We have all of those available to us in Travis County. Did we start there? No. It has been years and years of development over time, recruiting those providers, training the providers, identifying service needs in collaboration with our families, looking at what our community gaps are, figuring out how we can fund those. So it's been a development over time, but it's allowed us to create a rich array of services and support so that families actually have a choice in their service provision. They can decide, you know, recreational therapy and a mentor and individual therapy is what I would like for my child, along with some respite and a pro-social group. That really allows families choice. And then additionally, families come to us in all kinds of situations, and you have to be able to meet them where they are, right? So we need to be able to have access to funding for basic needs support so that families can be able to have their basic needs met in housing, food, utilities. And so there are some dollars that allow us to fund those supports as needed for families. Okay, so I'm moving towards the end of my presentation. Just a couple more slides. But before I go into the last part of the infrastructure discussion, I felt it was important to give you some definitions so that you can refer back to them regarding funding options within a system of care. They're generally referred to as blended funding, braided funding, and flexible funding. The definitions are there, and I won't read them to you, but I wanted you to have them as I move forward in talking about how we utilize funding for our system of care in Travis County. In our system of care, we basically are doing a braided funding initiative. And that means that funding is coming from various different sources and being braided together to fund our system of care. The money is being braided through contracts, and those contracts are managed through our MHA, our Mental Health Authority, Austin Travis County Integral Care. We have several different contracts with them, and in those contracts we designate the services and supports that we are wanting families to be able to have access through the contract, and then they manage the funding source and ensure that each funding is sent to the right source and each family is funded with the right program. So they're doing a lot of work behind the scenes, and there's payment for those services that they provide to us as the MSO. Additionally, we have individuals managing line item designations for our funding. And the partners that are participating in this are Travis County Health and Human Services, who has a contract with Austin Travis County Integral Care, Travis County Juvenile Probation Department, who also has the contract. Austin Travis County Integral Care, the Child and Family Services, has a designated line item set aside for the children that are being served within the most complex of our service programs, which would be the Children's Partnership. And then we also have the City of Austin, and we're utilizing CDBG, Community Development Block Grant dollars, Youth Development Funds to support our system of care initiatives. And those dollars are available to communities who have access to CDBG. They're just not usually used for youth development dollars. But in our community, we've been willing to do that, and that's been extremely helpful. So all those different funding sources are pulled together through contracts that are managed and allow us to fund the services and supports for families. Additionally, an additional highlight regarding that is the flexible funding piece. And I wanted to just show two things along that. So Travis County Juvenile Probation Department, which is one of our partners, has funding set aside in a contract. And one of the wonderful things that our partner has expanded to do is they're allowing those dollars to be expended on any child that's involved in a system of care initiative, even if they're not being supported directly by a juvenile court care coordinator. That allows those dollars to flow across the system and has been extremely helpful in our sustainability efforts. Additionally, Travis County Health and Human Services allows their funds to be expended on any child who's in a system of care initiative. Again, that allows the dollars to flow more freely and allows us to individualize it. And then finally, we've been utilizing non-ed funds through Region 13 for years to access flexible funds for children who meet the criteria. And that, again, has been another resource. So we're looking at all of the funding that's out there, figuring out how we can access it, and then how we can bring it into serving and paying for the supports and services that families are identifying that they need. And finally, this is the team of people, the System of Care Management team. And I may be doing the presenting today, but behind the scenes are all these people doing hard work every day to ensure that we can be successful in reaching our goal eventually to be the System of Care site in Travis County. Thanks so much for your time.
Thanks, Laura. There's been two questions posed to you, so I'm going to ask those both to you now, and then I'm going to mute my mic so you can respond. First, someone would like to know more about your CPS reintegration project, briefly, maybe in a minute or two. And then the second question that was posed is, has there been any interest from the contiguous counties surrounding Travis County to be a part of this blended funding cycle, or could it be expanded beyond Travis County, if that's ever been a thought? So I'm going to mute my mic and let you respond.
Thanks, Erin. Okay, so the CPS reintegration project is a project that was developed in 2007, and the concept behind it is it's based on the model of system of care values and the wraparound process, and the idea is bringing children out who are in child welfare residential placement. So they're in placement, paid for, funded through child welfare, who has custody of the child or may jointly share custody with a parent. They're in CPS custody primarily because of mental health issues, meaning the child's needs couldn't be safely managed in the community. We exhausted local resources, and the child had to go into state custody to get their mental health needs managed. So that's the primary group that we're looking at. Children may be in therapeutic foster homes. There may be other complex issues the family is managing, but in general, we're working with those groups, and we're utilizing the values of the system of care and the wraparound process to meet with the families early on, working with CPS to reintegrate those children to our community. And we put this in place because these kids are our children. This is our kiddos, and we need to support them coming back to our community. And so we wanted a program that would really specialize in being able to do that with that population. And regarding the second question, the idea of expanding the system of care to contiguous counties, I think is a wonderful idea. We have not embarked on that. I think we've been inwardly focused for several years trying to ensure integrity to our work. But I think the idea of being able to collaborate effectively with other contiguous counties is very important, because our families move and travel between county lines all the time. And so for them to be able to have similar services and supports regardless of where they live is important. And I think I'm hoping that the asset grant will be one of the tools that we're going to use as a local community and as a state to be able to do that, so that we can take the lessons learned and apply them to other counties and be able to better coordinate our efforts. Thank you. Thank you.
Again, thank you, Laura. I really appreciate it. You did just like we thought you would do. You hit a home run. So now we're going to move on to the next section of our webinar, which is we'll be turning to county and talking to some of our folks up that way in Mental Health Connections. So if you Tarrant County folks could get your webcam on, I'm going to go ahead and read your bios. Please keep your microphone muted until I'm done, and we will get started up there. But in this part of the presentation, we wanted to focus on the system of care values of community-based, with locus of services being done in the management setting of a local community. And the second system of care value was culturally and linguistically competent, with agencies, programs, and services that reflect cultural, racial, ethnic, and linguistic differences of the populations they serve to facilitate access to and utilization of appropriate services. And Tarrant County, and specifically Mental Health Connections, has done a ton with that. So our first presenter today with Tarrant County would be Susan Garnett. Hi, Susan.
Hi there.
Nice to see you, Erin. Susan is the deputy CEO.
Hi there. Nice to see you, Erin.
Susan is the Deputy CEO of MHMR of Tarrant County. She has been with the agency for 16 years, and she received her bachelor's and master's degrees in social work from Barry University in Florida. She has worked with a variety of human services throughout her career. In addition to her work at MHMR of Tarrant County, Susan has participated in a number of system change activities that are directed at assuring systems are responsive, consumer-focused, efficient, and forward-thinking. She's the current chair of the Mental Health Connection of Tarrant County. She's a former chair of the board of ARC of Texas. Susan and her husband have 3 adult sons, one of whom has developmental disabilities, and they live in Fort Worth. And Susan, if you can bear with me, I want to go ahead and read Estrella's bio, and then I'm going to turn my mic off and turn it over to you, okay? Estrella Griggs is the Cultural and Linguistic Competence Coordinator for Hand in Hand, a system of care grant in Tarrant County. Estrella is currently employed by Santa Fe Youth Services and has served in several different capacities over the past 15 years with that agency. She has been in the position as the CLC, or Cultural and Linguistic Competence Coordinator, for the past 2 years. As the CLC coordinator, Estrella has been trained to be a master trainer in the California Brief Multicultural Competence Scale, or CBMCS, curriculum by Dr. Gloria Morrow. Additionally, as a part of the CBMCS training team, Estrella has helped to train over 300 participants using that curriculum. Estrella holds a license as a chemical dependency counselor and is expected to graduate in May 2012 with a master's degree in counseling psychology. So happy early graduation, and I'll turn it over to the Mental Health Connections team.
Well, thanks everybody, and greetings from Fort Worth. So we're going to talk a little bit about the Mental Health Connection, which is really the infrastructure that we put in place here in Tarrant County for our system of care before we actually probably even knew the word system of care. Just to give you a little bit of background about the origination of the Mental Health Connection, we had a terrible tragedy here in Fort Worth in 1999 where a man with untreated mental illness went into a church and opened fire and killed a number of people and killed himself. And as the community began to recover from that incident and consider what had happened, it really shone the spotlight on untreated mental illness. It shone a spotlight on issues of stigma and isolation and adequacy of resources and access to resources, and what do we do in a community where many people recognized there was something wrong but nobody knew quite how to reach out to him or what to do. And so it really caused our community leadership, the mayor, county commissioners, other community leaders to get together and to talk about what could be next in our community and how to ensure that our community agencies work together and that we all addressed what we were just beginning to recognize was a growing need in our community, mental illness. And so our then mayor really charged the community of mental health providers to go off and figure out how to work together and how to address the true needs of the community, and not think as a collection of individual providers, but to really think as a community and to think about what our community needs. So that was the basis on which we began to form the Mental Health Connection. So one of the things that we recognized fairly early on was that in our community we felt like we really needed to establish an infrastructure. So we created a private nonprofit, a 501c3 corporation. You heard Austin Travis County talk about the development of that themselves. And originally we were really kind of working as a collaboration of providers together and kind of sharing some of the need to take care of the little details of establishing meetings and some of those kinds of things. As time went by, after a few years, we determined that we really needed one staff person who organized all of that work. And so we hired a director, Patsy Thomas, who some of you may know, or if you don't know, you might want to know. And as Patsy describes herself, she's really the traffic cop for our collaboration. She's the one who, takes a look at all of the needs and kind of keeps everybody moving in the same direction. We created a board structure. We have a 9-member board. And one of the things we did that I think ultimately was very important to us very early on was that we established a membership dues structure. We created a dues structure which was based on the size of the budget of your organization, so that very large organizations pay more than very small organizations, but everybody's welcome to participate. We actually have today and have always had individuals who participate with us who don't actually pay dues, but who participate, who volunteer, who engage in our work. And our goal ultimately is to have very, very broad participation. But the membership dues we thought were critical for us to ensure that we knew who really wanted to participate, to have enough funding to make sure that we could hire a staff person and have certain work done on a regular basis, and ultimately to be sure that we didn't have an organization in Mental Health Connection that had to support itself by writing grants and that sort of thing, so that we would have more uncertain types of funding. We really wanted to have a fairly certain funding structure. So in addition to our board structure, we have a committee structure. We impanel committees on an annual basis based upon the work we intend to do that year. Many years committees roll over and continue to participate, but we really want the opportunity every year to reconsider what will be the work of our organization and what committees do we need in place to do that. So we have some of the committees that you would expect in any organization, you know, like a finance committee to take a look at the funding of our organization. But we also have committees based on the particular needs we're dealing with at that time. We really intended the Mental Health Connection from the beginning to be a vehicle for us for long-range planning for our community. We knew from the beginning that we wanted to see changes. It was no criticism of any organization that existed, no criticism of the mission of any organization that was in our community, but it was a sense that we can do better together. And how do we begin to make that shift of working together and understanding one another's needs, understanding one another's pressures, and seeing opportunities for all of us. So we really put a lot of effort into how to create really meaningful alliances for us. One of the things that we have done from the very beginning of the Mental Health Connection is have monthly membership meetings. And those monthly membership meetings is where many of our members, although not all of our members come to every meeting, but most of our members come to most of those meetings. They're the second Monday of the month at 8:30 in the morning. And we never have less than, I'd say, 40 people in the room, and have as many as 100 people in the room, depending on the topic. So the meetings are important to us for the conveyance of information, but the meetings are also important because next to the last bullet on the page, creating meaningful alliances. They've really been a great vehicle for us to get together with one another and to work on projects together. The Mental Health Connection's work has really drawn on resources from all of its members. We really intended for it not to have a huge infrastructure, but instead for the agencies to continue to have to contribute to keep the Mental Health Connection alive and well. So, when we think in our community about the benefits of membership and participation in the Mental Health Connection, we think about the ways we have the opportunity to share the costs and expertise for different things. Planning is certainly one that has been notable lately. We're in the process of being very engaged in a strategic planning activity right now. But shared costs and expertise for grants has been really important. Prior to the development of the Mental Health Connection grants process, we had a community, like I think probably most communities, where every one of us are looking at the same grants notices and considering applications, and each agency tended to work on its own for grant applications. Sometimes we wanted to do different things with the money. Sometimes we wanted to do the same thing with the money, but we just had different interests of it going into different agencies. So we created a grants process where we come together on a regular basis, reviewing the grant notices that are available and considering whether there's collaboration. Sometimes we find 2 or 3 agencies that are interested in the same funding, and so what we sit down together and try and figure out, is there a way for us to accomplish what we all are interested in accomplishing, but do it in a collaborative fashion so that we all work together on the grant. Sometimes we find we really are looking at doing different things with the money, and so it makes sense for there to be different applications for the community and let the funder decide what they want to fund. But for the most part, it really has created opportunities for our agencies to work together in grant applications. Training is also an area where, for some of our larger agencies, training dollars are more readily available than in some of our smaller agencies. So we know that we had a circumstance in our community where individuals who work for some of our smaller agencies really didn't have access to as much high quality training, and so we use the Mental Health Connection as a vehicle to bring in training that everybody has access to, to really improve circumstances of all of our agencies, which we believe improves the circumstances of all of the people who come to our agency. We don't want people who are seeking services to have to sort through whether they're going to an agency that has a well-developed and has access to a lot of very expensive training, or an agency that doesn't. So we thought that was good for us. Evidence-based practices. We know that not every practice in every agency is an evidence-based practice, but Mental Health Connection really wanted to take the opportunity to lift our eyes off the horizon and look further down and consider whether where and when we can improve the use of evidence-based practices, and where Mental Health Connection can play a role to bring more information regarding evidence-based practices in. And then social marketing. In our agencies, we all looked at social marketing as really being focused on marketing our own agencies. And this was really an attempt to look differently at social marketing and really talk about issues like stigma that affect all people and that affect all agencies, but how can we work collectively on topics like that? So, as we talked about what we wanted to build with Mental Health Connection, and as we've talked over the years, one of the things that we've known was always very important was that everybody who participates in every agency has an equal voice. While, as we talked earlier about the dues structure and the fact that the larger agencies pay larger dues, we didn't want to create a circumstance where the larger agencies had votes that were more meaningful than the smaller agencies, because everybody contributes and just contributes differently. When it comes to participation in, for instance, volunteer activities, we know that an agency that has hundreds of staff will more easily contribute that staff person than an agency that has dozens of staff. So we think in the end the participation is really equal. So all of our members are participating in different ways in developing a new strategic plan. This will be, I think, the third strategic plan that we've had in our lifetime as an organization. And so we have really a very broad-based approach to strategic planning. We want to hear from people who are regular participants. We want to hear from people who are former participants. We want to hear from people who haven't yet participated. We want to hear from people who know us at a distance but haven't seen this as an issue that was most important to them. So we really take a very broad approach to the strategic plan because, again, we don't think of our strategic plan as being developed simply for the Mental Health Connection, the organization. We don't think of it as being developed simply for any one or a collection of our member organizations. We really think of it as being about our community and what our community needs. We think it's very important to have broad buy-in from our members because ultimately the projects and activities that we identify through the strategic plan will only be worked on by the work of our members. And then again, we have just one staff person who manages the activities, who acts as that traffic cop directing people through the processes. Since the beginning of the Mental Health Connection, we've had the same mission, no wrong door to the right mental health resources. We know that what we heard from people is that I can't tell if there are enough services there. I can't tell where the resources are. If I go to one place and it's not the right place, I don't have the confidence that I get directed to the right place. These are the things that we heard from the beginning, and that at every juncture where we've reaffirmed, we have reaffirmed that this is the mission, no wrong door to the right mental health resources. And so, what we know that people have asked for is service improvements. They want to see more. They want to see services to be better than they are today. And everybody that I know of that works in an agency is proud of the work that they do, but knows that there's a way for things to be better. And that better is one of our ambitions over time. And effective referrals. Not every agency can be everything to everybody. So where you're not the right agency, help people get to the right agency. We think that your obligation exists to do more than just say, not me. Your obligation is really to direct people more fully to where they do belong. And that the system be responsive. We hear this over and over again from families of kids in services, from people who seek services. They want to know that when they reach out to agencies, that agencies reach back to them. So when we think about what's important to sustain our system, and as talked about earlier, we have here in our community, the city of Fort Worth had a system of care cooperative agreement, And that was a very successful initiative, followed up by the initiative we have today, serving different people, serving different geography. But, you know, another cooperative agreement, the current one is hand in hand and working in a broader community, a multi-county community. So, you know, we think that the dollars that come into our community through the cooperative agreements are incredibly important for getting things started, but sustaining the system, keeping it going is really our obligation. And so we've worked from the very beginning as, you know, to head toward the time when those dollars wouldn't be there. So we've tried to do things that help build the infrastructure. You see first on that list, leadership training. We think you know, helping people know how to do their business better, but also how to lead the agencies of tomorrow is really important. We've had some different training initiatives. We've had, some of you are familiar with the Bridging the Gap training series that we did for 5 years. We've now finished that series, and we've more recently done some different kinds of leadership training that's all been a part of our search conference and search process as we're developing our strategic plan. We really think it's important to identify emerging leaders and help bring those people along, particularly in the values that are the values of today's system, which you heard Sherry and Lori talking about. Engaging non-traditional partners. You know, we sometimes talk a lot to one another, and it's important for us to pause and reflect on who the other partners that our families are dealing with are. Their traditional healthcare providers, there are other kinds of organizations, whether it's parks and recs departments or schools or other places where kids go that are outside of the mental health system, and how do we create relationships with those agencies and those organizations to benefit our people in our system, children and families and adults. So we know it's really important that we all achieve buy-in regarding our priorities, and so that's why we have extensive processes when we're developing strategic plans. And you know, to sustain the system, we really have to think through what individual and agency contributions are, and this is never more important than it is today, when all of the agencies are really pressed and you know, have to think hard about where they're going to devote their dollars. And so we're extremely appreciative at the Mental Health Connection that so many agencies who were contributors at the very start continue to be contributors today, and in fact many of them have actually enhanced their financial participation because they believe that this is a good buy. So that when we think about, we have to think about challenges for the future. And the issue of gaps and exactly what gaps there are that we can address at this level is incredibly important. So, you know, we always we don't want to just start from the premise that we don't have enough. We have to understand what we have and understand whether what we have today fits together in the way it should, and whether there's then what are the gaps that we have in the system and how can we address those. The issue of outcomes that we know that it is so important for the future that we all be able to define the system of services to people, the systems that provide mental health services, and that we be able to demonstrate the outcomes, that this will become increasingly important as funders of these and other answers want to know what did those dollars do. So access to services is an important challenge for us, and access is broader than just are there enough services. It's about locations. It's about new ways of reaching people. You know, the traditional model of having somebody come in between and get a service and schedule an appointment for next time and show up for that appointment, that may or may not be the way that people best access services in the future. So we'll have to think about that. And then one of the topics that comes up over and over again for us is workforce challenges. We know that the workforce that we have today is not adequate to meet the challenges of the future. And how do we develop a new workforce? How do we bring young people into this workforce excited to do this work? How do we compete with other you know, different kinds of areas that are also looking for young, excited employees? So, you know, this workforce issue, you know, we know that Texas doesn't have enough doctors, it doesn't have enough psychiatrists, You know, we have to look at practice issues for other disciplines. We have to look at ways to extend our workforce, access use of other initiatives like telemedicine, which we think about in rural areas, but they're every bit as important in urban areas. So all of these things are challenges that we know we have to address. And so, we think about, other challenges. We've done a lot of work here locally in thinking about adaptive actions. And we will have to adapt in a different way. We've done a lot of work here in a recent conference, and I know Sherry participated in, as we thought about technical solutions and adaptive solutions. And we see the challenges of our future really being adaptive challenges that we'll look for different kinds of solutions than we looked for in the past. So we'll have this ongoing exploration of gaps as well as resource development. And again, when we talk about resource development, we don't mean something as simple and straightforward as lots more money. We mean, how do we really look at the resources we have in our community and spend our resources most wisely? Engagement of non-traditional partners, and then we had a little bit of conversation earlier on this webinar about family involvement, and how we ensure that our family systems are the systems that are responsive to family, that meet families where families are. I heard mentioned before of nothing about us without us. These are all the issues, and we certainly, like I think most communities, grapple with encouraging family involvement, meeting families where families are, and getting as much input as we need from families. So with that, I'll turn it over to Estrella, and we'll start talking about one of the really specific challenges that we recognized we needed to face and we started working on, which is the issue of cultural and linguistic competency. We spoke earlier about cultural and linguistic competency and the importance of addressing people in the right kind of way, and I think we've done a lot of work, and I'm happy for you to hear from Estrella as we talk about that.
Very much, Susan. Okay, so I'm going to talk about the cultural competency and linguistic piece of the System of Care initiative that we do here in Tarrant County. It started back in 2007. It's an offshoot of the Mental Health Connection, and Susan mentioned the Bridging the Gap conferences. And part of that Bridging the Gap conference was, from that were developed learning communities. And one of the learning communities was the At-Risk Prevention Program community. And when they were researching kind of what kind of programs and what kind of programs would be appropriate for at-risk kids in Tarrant County, the research indicated before we could identify a program that we needed to address the issue of cultural competency. So the research indicated that cultural competency is critical for services to have positive outcomes, and that another part is the national evaluation also showed that many systems of care were inadequate in the area of cultural competency. I think I'm clicking the wrong one. And in addition to that, to bring about systematic and sustained change, all three levels must be addressed. We must address the cultural competency at the provider level, at the organizational level, and at the policy level. Prior to kind of doing this doing this piece of the system of care, the community kind of thought cultural competency, I'm going to go to this cultural competency class and we're going to do, diversity, I'm going to learn how to deal with different people, and then check, it's done. From this research, we have learned that cultural competency is much bigger than just race, that it is very interwoven into everything that we do. So that was one of the lessons that we learned, and that provider level, again, organizational level and policy level, there has to be change. I'm clicking the wrong way. Okay. So another thing is the multicultural organizational development requires that fundamental transformation of an organization's culture. Again, throughout the research, we learned that it's not just enough to have that culture exists everywhere. culture exists in the organization and in the people who work in the organization. So in order to have an organizational transformation, you have to work on changing or adapting or learning the values of the people that are in the system, addressing their assumptions or their mental models about the people that they serve and maybe the people that they work with. And so all of these things, the relationships, and not just relationships with consumers, but the relationships with the co-workers and other agencies, all play into this change or transformation in cultural competency. And there you go. Plays into an organizational culture. Okay, so where we have been. 2007, again, we developed the learning communities, and from that learning community, an implementation committee was formed. And from that, we started the CBMCS, and we had retreats. CBMCS stands for the California Brief Multicultural Competency Scale. And that was one of the programs that were researched in the implementation committee. And from that, we did executive retreats because change has to happen from the top and the bottom. So we did a series of executive retreats, and we did a series of retreats for the practitioners. And what's significant about these retreats is that there were 18 different agencies, and from those agencies, there were 40 executives that participated. So we all started the language of kind of change from the top, and everybody was kind of on the same page with what needs to happen in Tarrant County as it relates to culture. Okay, so where are we now? Currently, we have trained over 300 participants in the CBMCS training. We have 3 agencies in Tarrant County that are completely trained. And in addition to that, we brought the Visioning Forum. We had a Visioning Forum, and we had consultation with experts. We brought Tawara Good from the National Center of Cultural Competency down, and she kind of helped us with some technical assistance on what needs to be, what kind of things that we're already doing and what kind of things that we can tweak. And from that, we have bi-monthly executive breakfasts. And the executive breakfasts are regularly attended. 15 to 20 execs attend the breakfasts. And we have the CLC Book Club, which is an opportunity to kind of continue the conversation around culture as it relates to the information that we've learned. And this is our branding. One of the things that we learned as we were going through this process is that a lot of the community was identifying CBMCS, the training that we do, as cultural competency. And so we went through the process of, no, CBMCS is not the cultural competency piece. It is just an offshoot. So we went through the process of branding, and that is our little marketing opportunity, and it says branding, cultural connection, and it's exploration and human understanding. Oops, clicked the wrong thing. And lastly, where are we going? Where are we going now? Okay, we have added new CBMCS trainers. We have 5 annual CBMCS trainings scheduled. In November, we are working on one of the issues that came up that Tarrant County is kind of lacking in is knowledge and an understanding around the LBGT community. So we're working on doing a forum in November. We've participated in a search conference and worked on platform groups. And the experts and executive directors, board development, and organizational assessments is kind of where we're going now. And so that's all I have.
Thank you, Susan and Estrella. I really appreciate it. We are running a little short on time. There were a couple of questions that were brought up in the chat. If you could please try to log in and answer those. One of them is, what was the process like of getting organizations on board to contribute dues? And the second was, what is the ratio of families to professionals within Mental Health Connections, and do the members have to pay dues? So if you could just log into the chat, Susan and Estrella, and try to answer those, that'd be great, so we can move on and get Jim on the line.
Okay.
Thank you. Thank you very much. All right, so our next presenter is Jim Womack from Amarillo. He's in one of our system of care expansion communities. One of the ways we wanted to look at this was not only at the overall underpinnings and principles and philosophies of system of care, but also, at how communities are utilizing those core values currently, and then why would anybody want to do this work? And so, with no money, no federal funding, and just loads of support from the asset grant, Jim and his team has agreed to be a part of our expansion efforts. So we'd like Jim to speak to that. And just briefly, Jim Womack is the Director of Planning and Public Information for Texas Panhandle Centers, Behavioral and Developmental Health. And so, not to go into great detail, so we can let him start talking, we'll publish everyone's bios at the end of the webinar. So Jim, it's all you.
Okay, well, appreciate it, and good afternoon, everybody, and greetings from Amarillo. I know we're running long, so I'm just going to give a short overview of why we, well, like you said, why we wanted to participate in this when there really wasn't funding wasn't guaranteed, anything like that. So I think I can speak for the webinar participants we have from our area, and that we have already learned a lot just by what we've heard and seen today. So, well, I have a PowerPoint. It's not showing up, but basically I was going to give you a kind of an agency background. We started as two organizations, Texas Panhandle Mental Health Authority and Amarillo State Center. We merged back in the year 2000 to form Texas Panhandle MHMR. And last year we changed our name to Texas Panhandle Centers, Behavioral and Developmental Health. We are the local mental health authority. So we thought as a local mental health authority we would be in a good position to coordinate the systems of care development process in our region. Now as the local mental health authority, we work with a lot of different agencies. So we've grown really close to a lot of agencies recently, and we work really well with them. Now, I think my PowerPoint might be coming up right now. Okay. Okay. And as you can see there, we contract a lot of Texas state agencies, DSHS, DADS, DARS, DFPS, Tacoma. So when the state budget problems hit last year and the year before, we all took a big hit in our budget. So we any way we can find to work more effectively with our stakeholders and provide services effectively, we like to pursue those opportunities. This is our service area. We can see on the map there we cover the top 21 counties of the Texas Panhandle. And the map also shows our regional clinic locations. We partner with many local stakeholder groups all across the region in those communities that are indicated there. Some of the unique obstacles we face up here, I know everybody that's listening in has unique obstacles in their area, but the ones we happen to face include the size of our region. It's over 21,000 square miles, which is larger than 9 U.S. states. The majority of our area is rural, with the population center being Amarillo with 60% of the population. And that's what we see as the initial target area is Amarillo, with expansion out to the rural locations. The lack of rural psychiatric and social resources, which has been talked about. As I said, 40% of our service area population is in rural areas, but only 9% of the nation's psychiatrists practice in rural communities. And I don't know about everybody that's listening today, but we kind of have a problem recruiting psychiatrists and social service providers up to our area. I've heard people from Austin say, this is kind of they view Amarillo kind of as the Arctic tundra of Texas. And, it's hot during the summer, extremely cold during the winter, and it's windy all the time. And there's a grain of truth to that. But we have a lot of good things to offer too. So providers who do end up coming up here, they seem to love it. Now the distance between communities, sometimes if we have a client who lives up maybe in Perryton in the northeast corner of the Panhandle, it would be like a 5-hour round trip if they had to come to Amarillo to see a psychiatrist. So that would be a day-long process if a parent had to pull a child out of school to see a doctor. And it would be the same for our psychiatrists if they had to travel to Perryton and back. So we do have telepsychiatry or audiovisual equipment in each of our clinic locations to enhance service delivery. We also, here in Amarillo, have a large refugee population, which a lot of people don't know about. Specifically in Amarillo, Potter, Randall, and Moore counties. Potter County has less than 0.5% of the total population of Texas, but receives 8% of the refugee arrivals in Texas each year. We've had a refugee program through Catholic Family Services in Texas since the 1970s. Started out with refugees from Laos and Vietnam, and most recently, most of the arrivals have been from Burma, Somalia, Sudan, and Iraq. Now, many of the refugee children arriving in our area exhibit symptoms of PTSD. Now, many of these children have never even received any type of health care, let alone mental health care. So, that is a huge obstacle. And in our elementary schools, some of the schools, or at least one school I know of, has over 30 different languages spoken. And you can, there's other cultural barriers also in the families, like distrust of authority figures, unfamiliarity with American customs and laws. And one example of that would be recently, I believe it was last winter, one of the local police officers talked about how a Burmese family moved into an apartment complex and their heater stopped working during the winter, and they didn't know what to do about it. And what they did is they found a sign that said, if in case of emergency, dial 911. So they dialed 911, and you can imagine that created a lot of confusion. So, and luckily, our local police officers in Amarillo have come to understand these issues, and they've been a huge resource for the refugee population. And I appreciate the information that Estrella shared about their cultural competency program. Okay, this next slide just kind of lists some of our community stakeholders, partners we work with. So since we're short on time, I'll kind of skip through that. Well, really, it's about our Safe Schools, Healthy Students program, general probation, law enforcement, some counseling programs. We work really closely with our stakeholders. Okay, so what we are proposing to do as part of is the new kid on the block as far as systems of care is what we want to do is enhance and expand the existing wraparound successful service delivery model we have, which is Safe Schools, Healthy Students. We want to try to expand that model to other rural locations in our area, and thereby improving service delivery and outcome of children and youth with serious emotional disturbances, and also in their families, increased outcomes there. We would like to put in place an infrastructure and philosophy that can be maintained as federal funding decreases and after federal funding is no longer available. We believe that the strong relationship we've developed with assistance provided through Asset, we can enhance the development of a collaborative governing body. That's one of the challenges we're looking at. We work closely here in Amarillo and work closely with other stakeholders across the region, but trying to bring all those groups together, we see that as a challenge. And I appreciate the information Susan provided on their infrastructure and developing that and sustaining their system. Okay, objectives. We would like to transform and expand the existing wraparound school-based services, that's Safe Schools, Healthy Students, into a system of care service delivery approach within our local service area. And I basically just described that. Safe Schools has a really good model in delivering wraparound services. I won't go into that description. We want to increase family involvement in both our wraparound service delivery approach and also in our system of care expansion process. As the Sherry was talking about earlier, we believe that family involvement and input is a critical part of this project. Also, we would like to improve individual outcomes, of course, decrease behavioral concerns, improve academic performance, and decrease contacts with the juvenile justice system. We'd also like to identify challenges or issues issue areas to be addressed in the strategic plan in our local service area. And the strategic plan, we look at that as being the most important part of laying all this out. So we look forward to participating in that process. Again, some of the challenges we expect to face are the collaboration, getting everybody together across the entire area, funding, finding the future funding streams, and I like the information that Laura presented earlier about their how they fund their system of care is appreciated. So again, we've learned a lot just by participating in this this webinar. Also, youth involvement. We kind of we kind of see that as an obstacle. Getting youth engaged. As Sherry talked about again, it's important to have youth guidance and development. So basically, through that strategic planning process, the ultimate goal is to put into place an infrastructure that can be sustained as our federal and state funds decrease, and after federal funds are no longer available for our Safe Schools, Healthy Students program, which is actually in the last running towards the end of their grant cycle. We would like to find ways to sustain that. So again, that is a very short overview of why we would like to become involved. And if you'd like any further details as far as our part, please ask. And also my contact information is there on the bottom of this slide here. And I guess I'll now turn it back over to Erin.
Thanks, Jim. I did have a question for you. You were one of our competitive applicants as an expansion community, and we were intrigued since we had so many applicants to the process as to, first, what really drove you to apply? You said you were starting from the Safe Schools grant, and you wanted to continue some momentum. So what attracted you to being a part of our effort, just kind of in brief? And then second, what's the one thing that you're most excited about seeing happen?
Well, the thing is, as far as why we wanted to apply, again, we saw the positive results that the Safe Schools, Healthy Students program has, and our community stakeholders are really invested in that, doing the right thing and working together. And we realize up here that, we have to work together, to kind of survive. And by doing that, we can provide effective services and more efficient services. So that was one of the reasons we applied. Is we saw what we were doing here in Amarillo. And there's some surrounding communities, that have some certain issues like, bullying in schools, substance abuse, that type of thing that we believe the Safe Schools model can address. And through this, through asset, we believe we can put into place a plan that we can, address those issues in surrounding areas and, benefit the entire area. Because, we are up here, in the Arctic tundra, so it's we kind of have to work together. And could you repeat that second question?
Sure. What is one thing? I mean, I know there's many, but is there one thing that you're really excited about seeing have happen as a part of this expansion effort?
Well, actually, it's already happened today. It's already happened today just by participating in this webinar. Is learning the best practices and evidence-based, practices that other programs have used. Like Tarrant County, the funding streams, trying to find future ways to develop those funding streams, ways to address cultural competency. So really, just learning from other programs that have already had this in place for a few years is kind of one of the things we're really looking forward to, and also developing that strategic plan and getting a governance structure into place. We're really excited about that because we have all the pieces here and we work really well together. But I think it's like a big puzzle. You just have to get those all together and into place and fit together.
Thank you, Jim, and I think that's a great soundbite to end on. So thank you so much for your time. I apologize for keeping you at the end, but I know when we get this up on the website, people will be excited to hear about what you're looking at doing. So thank you so much. I'm going to go ahead and move us into the reception room. So Jim, if you want to turn your webcam off, great. So for those of you who are still with us, on the left side of this room, you can see that there is a link, Web Links Pod. That is the Texas System of Care 101 webinar post survey. That's so that you can give us some feedback on the content relayed today. Also the CEU certification survey for those of you who are going to be actually a part of needing a CEU verification, please link on that. And as Molly posted earlier, we will also entertain any emails that you send us, since we did run a little bit long. In the chat log here in this room, you can see that I have links directly to the survey, so if you have problems getting there, feel free to click on the hyperlinks. And then, what other notes do I have here? Let's see. All PowerPoint slides and handouts, as well as the CEU certification form, are in the files to PodShare, so please download those. This room will remain open for at least an hour to an hour and a half after this broadcast, so feel free to come back and link in at your convenience. Again, thank you so much for your attendance. This was wildly successful and much better received than we had anticipated, so we were absolutely optimistic. Thank you, and have a good rest of the day.